Bismillahirrahmanirrahim. Assalamu alaikum. Hope everyone is fine by the grace of Almighty Allah. Today we're going to discuss management of cancer and principle of cancer surgery. The traditional approach to cancer concentrates on diagnosis and active treatment. It implies an attitude to the occurrence of cancer that is too fatalistic and an assumption that once active treatment is complete, there is little more to be done. Prevention is often forgotten and rehabilitation is ignored. The management of cancer can be considered as taking place along two axes. One is an axis of scale from the individual to the world population, and the other is an axis based on unnatural history of the disease from prevention through to rehabilitation or ultimately up to palliative care or terminal care. So, in a brief, management of cancer would include prevention, screening, diagnostic, and classification, investigation and staging process, and ultimate therapeutic decision making. You just recall the previous lecture. There are certain causes of cancer, and if you just avoid that, the chances of cancer recurrence from preventable causes, of course, would be reduced. In 1998, Sir Richard Doll estimated that around 30% of cancer deaths were due to tobacco use, and that up to 50% of cancer deaths was related to diet. So many cancer could be prevented if people ate sensibly and exercise more. Preventable causes includes smoking, alcohol consumption, ionizing radiation, and ultraviolet rays. While screening involves the detection of disease in an asymptomatic population in order to improve outcome by early diagnosis, it follows that a successful screening program must achieve early diagnosis and that the disease in question has a better outcome when treated at an early stage. There is certain criteria for screening test and for screening program that are summarized in the slide. Like for the disease, it should be recognizable disease at an early stage, and treatment at an early stage must be more effective than at a later stage. For the test, it should be sensitive and specific to the disease, it should be acceptable to the screen population, it should be safe and inexpensive, while for the program, adequate diagnostic facilities for those with a positive test through the screening program. There should be high quality treatment for screen detected disease to minimize morbidity and mortality. Screening test should be repeatable at interval, in particular if the disease is of insidious onset. Benefit must outweigh physical and psychological harm. Diagnosis and classification. Accurate diagnosis is the key to successful management of cancer. Precise diagnosis is crucial to the choice of correct therapy. Like a wrong operation, no matter how superbly it's performed, is useless. An unequivocal diagnosis is the key to an accurate prognosis. Cancer is a disease of cells, and of course, for accurate diagnosis, the abnormal cell need to be identified. Different tumors are classified in different ways. Most squamous epithelial tumors are simply classified as well differentiated, moderately, or poorly differentiated. Similarly, adenocarcinoma are often classified as well, moderate, or poorly differentiated. But there are some exceptions as well, like a prostate cancer is staged according to Gleason system. In investigation and staging, it's not just sufficient simply to know that a person is suffering from a cancer. Its site and extent must also be known. But with the effect of that, like if it's a localized disease, then local region treatment such as surgery and radiation therapy may be of curative. But if the disease is widespread, then although such local intervention may contribute to cure, there will be insufficient and systemic treatment in the form of some drugs like chemotherapy or hormones will also be required. While staging is the process where the extent of the disease is mapped out, initially, a couple of years ago, the staging used to be a fairly crude process based on clinical examination, X-ray chest, and sometimes ultrasound abdomen. But now, a lot of sophisticated investigation are available, like in the form of CT scan, CT PET, and MR scan. So if you just compare the staging process of a recent era to 10, 15, or 20 years ago, there definitely would be a paradox of stage shift. Like the patient at a lower stage 20 years ago would have a higher stage and even then would have a better outcome in current era, and this is termed as Will-Rogers phenomena that was named by Alvin Feinstein. International Union Against Cancer is responsible for the TNM staging system that's most commonly used in most of the tumors, where T stands for size and extent of invasion of the primary tumor, N stands for number and location of histologically involved lymph nodes, and M stands for presence or absence of distant metastasis. This system is compatible and relate to the American Cancer Society system for stage grouping of cancer. As the management of cancer become more complex, it become impossible for an individual clinician to have the intellectual and technical competence that is necessary to manage all patients presenting with a particular type of cancer. The formation of multidisciplinary team represent an attempt to make certain that each and every patient with a particular type of cancer is managed appropriately. Team should not only be multidisciplinary, they should be multi-professional as well. A typical multidisciplinary team would comprise of site specialist surgeon, surgical oncologist, might need a plastic or reconstructive surgeon, clinical oncologist, radiotherapist, medical oncologist, diagnostic radiologist, palliative care physician, pathologist for exact diagnosis, speech therapist in some sort of cancer, particularly involving upper airway, physiotherapist, prosthetist, particularly if the tumor is involved in the distal limb, and in the treatment it might need amputation. Clinical nurse specialist, Macmillan nurse for symptomatic control and palliative care, social worker, medical secretary, audit and information coordinator. There are definitely some advantages and disadvantages of multidisciplinary team. If you just go into the advantages, there would be open debate concerning management. Patient has advantage of many simultaneous opinion from many different specialists. Decision making is open, transparent, and explicit. Team member educate each other. A useful educational experience for trainees and students, and performance can be monitored by managers. While the disadvantages would be that an opportunity for rampant egotism and showing off, less confident and less articulate member of the team may not be able to express their view even though their view may be extremely important. Decisions are made in the absence of patients and their caregiver. Clinicians are able to avoid having to take responsibility for their decision and their action, the fig leaf of corporate responsibility. Is time consuming and resource intensive. Now we're going to discuss about principle of cancer surgery. For most solid tumors, surgeries mean the definitive treatment and the only realistic hope of cure. However, surgery has several roles in cancer treatment, including diagnosis, removal of primary and metastatic disease, palliation, prevention, and reconstruction. In diagnosis and staging, most of the tumor uh, are already diagnosed before we go for a definitive surgery, but sometimes surgery has a paramount role in the diagnosis and even in the staging process. Like a person suffering from peritoneal metastasis, a laparoscopy would have definitely uh, excellent role getting the tissue for diagnosis, and particularly for intraabdominal malignancies like esophageal and gastric cancer, laparoscopy have a definite role. Similarly, laparoscopic ultrasound is a useful adjunct for the diagnosis of intrahepatic metastasis. Other example for diagnosis and even for the staging would be like orchidectomy in a patient suffering from suspected testicular cancer, and in a patient having multiple lymphadenopathy, particularly cervical, a lymph biopsy must be required for accurate diagnosis of lymphoma. Sentinel lymph node biopsy in melanoma and breast cancer is having an excellent role. Removal of primary disease. Radical surgery for cancer involves removal of primary tumor and as much of the surrounding tissue and lymph node drainage as possible in order not only to ensure local control but also to prevent spread of tumor to the lymphatics. It is important, however, to appropriate that high quality meticulous surgery, taking care not to disrupt the primary tumor at the time of excision of the utmost importance in obtaining a cure in localized disease and in preventing local recurrence. Under certain circumstances, surgery for metastatic disease may be appropriate. This is particularly true for liver metastasis arising from colorectal cancer, where successful resection of all detectable disease can lead to long-term survival in about one-third of patients. With multiple liver metastasis, it may still be possible to take a surgical approach by using in situ ablation with cryotherapy or radiofrequency ablation. Another situation in which surgery may be of value is in pulmonary dissection or isolated lung metastasis, particularly from renal cell carcinoma. While in palliation, in many cases surgery is not appropriate for cure but may be extremely valuable for palliation. A good example of this is that a patient with a symptomatic primary tumor who also has distant metastasis. In this case, removal of primary will increase the patient's quality of life but will have little effect on the ultimate outcome. Other situations where surgical palliation is appropriate include bypass procedure such as ileotransverse anastomosis to alleviate symptoms of obstruction caused by an inoperable cecal cancer, or the second example is unresectable carcinoma of the head of the pancreas and bypass surgery in the form of cholecystocystectomy or cholecystectomy to alleviate his jaundice would be quite beneficial. Hope this lecture would be beneficial for your learning process. If you have any question, please mention down uh, in the comment section below. And thank you very much for your attention.